Are there any cases that is not suitable, good and or bad for penile enlargement surgery? This also is an important topic. If you can estimate outcome from the beginning, you have to take this into consideration. There are both good and bad cases for this surgery. For example, there are two types of penises that is known by the public: flash penis and blood penis. I do not know if you have ever heard about that, but I have heard it from my patients. A patient comes and says that he has flash penis. What is a flash penis and blood penis? I will explain both of them. When it is a flash penis, it means that the penis is always out and also saggy. This is called the flash penis. If it is blood penis, penis is retracted too much, got smaller to the point that it is only 1 centimeter, but this is not buried penis. And when it is on erection, it pops up until it is 15 or 16 centimeters. This is called the blood penis. Penis that comes out with the erection. We do not like the blood penis when we do thickening. Why? Because during the surgery, penis comes out naturally. We do the fat injection properly, do the dressing and wrap it up. But a couple of hours after the surgery, penis is retracted and gets smaller. Fat injection that is made around it is folded with the skin. It doesn't look proper. These are all my opinions. None of them are in the textbooks. You can neither find the flash penis nor the blood penis in them. This is just a common talk, but also true. If the penis is retracted more than usual, then it is called the blood penis, and this is the correct term. And flash penis is always out. When the penis is always out and never retracts, the fat injection we made never becomes deformed and stays properly. But if it is retracted like blood penises, fat tissue is folded with the skin, so after the first fat injection, the penis looks nutty because the fat is folded and it looks like a telescope. We usually fix this performing a second fat injection. Patient must be informed beforehand. We must say that your penis is retracted more than usual. When we do the fat injection, it will retract again, but if we do another fat injection after 6 months or so, this situation will be fixed and it gets better miraculously. That retraction and folding does not happen anymore. Penile tissue that was made around it helps the penis to stay outside because it creates an elastic tissue around it. We can also talk about the quality of the fat that has been extracted from the abdomen. This is a very important issue. The quality is sometimes bad and sometimes it's good. We cannot possibly understand this before the surgery. I will be talking about this in my fat injection and thickening video. Sometimes patients say that they drink alcohol every week. They also smoke. So they do everything in their power to make the tissue edematous and to lower its quality. But when you operate on him to extract the fat, you see that the fat is as dry as mashed potato. When you filter it, nothing comes up. So that kind of fat sticks beautifully. But sometimes patients come saying that they never drink alcohol or smoke, and they think that they are so healthy. But when we extract the fat, half of it comes as water. So edematous, this kind of adipose tissues are not very successful in this operation, and it is impossible to know it beforehand. We can only see that during the surgeries. This is a really complicated topic. I will be talking about this in my thickening video in details. It is seriously complicated. Buried penis, if the penis is buried, this kind of cases are really difficult. The reason is that the patient wants his penis to pop out as much as possible. He wants it pop out 10 or 12 centimeters more. This is quite difficult. Even if you can stick it to 3 centimeters, this is an achievement. But the patient wants so much more. Usually this is how it goes, and fixing the buried penis is a seriously difficult operation. Radical methods should be followed for that. Beside the elongation, you will need other stitches, and you need to retract the peripheral tissues, and sometimes you need to stitch the penile skin to penis corpus. These are all difficult cases because the patient's expectation is high, but things that can be done are all limited and difficult. One of the bad cases is the patients who started to have sex and do it quite often. Some patients say that they have multiple partners and they have an extremely dynamic sex life. We should be careful with those patients because after the fat injection, patients should stop having sex for 3 weeks. If they have sex before 3 weeks, the adipose tissue is lost, it dissolves in blood, so these are also bad cases.